Demand on your care, medication management for older adults. Should medicines be kept in the refrigerator?
I'm concerned that storing medicines at room temperature might cause them to spoil. Is it safer to keep all medicines in the refrigerator?
In fact, not all medicines need to be stored in the refrigerator. Whether a medicine should be refrigerated depends on its type and characteristics, which are usually indicated on the drug label or instructions. Some common medications that require refrigeration include liquid antibiotic, unopened insulin, biologics, injectable diabetes medications, and vaccines, etc. These medicines must be stored in the refrigerator at temperatures between 2 and 8 degrees Celsius to maintain their stability and prevent them from deteriorating or losing their effectiveness. It's important to note that these medicines should not be placed in the freezer compartment of the refrigerator, as excessively low temperatures can also affect their stability and potency. On the other hand, most oral medications, including pills and liquids, do not need to be refrigerated. These medications can be stored at room temperature, and the recommended temperature range for storage is usually indicated on the drug label. For instance, some medications need to be stored below 25 degrees Celsius. It's generally advised to store these types of medications in a cool, dry place to prevent them from deteriorating due to moisture and high temperatures.
What if I were to put all my room temperature medications in the refrigerator? Would that cause any issues?
Generally, it wouldn't have a significant impact. However, the refrigerator can generate moisture, causing pills to become damp and affecting the condition of the medication. Liquids can also crystallize due to excessively low temperatures, altering their concentration. Therefore, it's not recommended to store such medications in the refrigerator. After a medication is opened, its shelf life may shorten, especially for loose pills and liquids. Under ideal storage conditions, loose pills can typically be stored for about a year. Older adults or caregivers should also be alert for signs of deterioration, such as changes in color, stickiness, odor, or mold growth, to avoid consuming spoiled medications, which could harm health. There's a misconception that storing medications in the refrigerator can extend their shelf life. This is not correct. If a medication, such as eye drops, indicates a specific time frame for disposal after opening, it's essential to follow the instructions on the drug label for proper disposal. In summary, whether medications need to be refrigerated depends on their type and characteristics. When storing medications, please carefully read the drug label. If older adults are unsure about how to store their medications, they should consult healthcare professionals and pharmacists for advice to ensure safe medication use. Please visit our website, Facebook, and YouTube channel for more information on elder care. Before you leave, remember to like and subscribe our channel.